Shoulder pain. Shoulder pain is a really common problem that many people experience at one point in their life. It doesn't matter if you're training a lot or if you're not training at all. When people come to me with shoulder pains, it's in the frontal side of the shoulder. The reason you have pain there is because of the processus coracoideus that comes out from the scapula. Your biceps is attached to it and your pec minor. There's nothing wrong with trying to treat this area, but if you don't address the posterior area, you won't get rid of the pain. I will show you how you can treat the area, some stretches that I would recommend to keep the pain away. I will show here on Benjamin which points are most important to treat around the scapula here. So this is the scapula. You have the infraspinatus. One point is here, you can see them on the picture. One point is here in the middle, and then one is closer to the humerus. The teres major is in the lower tip of the scapula, so it can be here or go towards the arm. The rhomboid, you can always find this corner here, inside of the corner. But you can go down between the scapula and the spine. But the important part is here. The levator scapula, it goes from the head down to the corner of the scapula. So this area is really important. It can also be that your lat muscle, pec muscle, trapezius can be a part of the problem. But those muscles are easy to stretch. These ones are not as easy to stretch. And if you treat the trigger points, your pain will be relieved much quicker. So how do you use this trigger ball? I do it like this. If you want a lighter treatment, you can lean against a wall. But this is super effective. I lie on my side. I put the ball. So I hit my scapula. And I start finding the points. It's much easier now when you know where the trigger points are. When I find it, you feel it, it's like electricity in your arm. And this is important. I stay in this position with a steady pressure. I'm not massaging it or moving it. I just put pressure downwards to the ball. I do it for 20 seconds. When 20 seconds are up, I increase the pressure. So I can use my legs to lift my body and increase the pressure. I do it for 20 seconds more. Then I find the next point. So I do the 3 to 4 points of my scapula. From there, I put the ball between my shoulder blades and I go upwards to the corner. I do the same. So I can even find the levator up here. So I do the same. I keep the pressure for 20 seconds, I increase the pressure for 20 seconds. Something that is really important when you do treatments with the trigger ball is that you keep a steady pressure. You don't do massaging, you don't move the ball around. You move it around until you find the trigger point and then you keep the pressure. You do 20 seconds and then you increase the pressure and you do 20 seconds. You don't have to do the treatment every day. You can do every other day or every third day, whatever suits you best. So there is 3 important stretches that I do with this stick. First one is supraspinatus. I hold my arm straight out, 90 degrees. I take the stick, go to my end point. I do 3 to 5 stretches. I take out my arm to the side. Here I want to find the teres major. Find the max tension. I do 1, 2, 3 to 5. Release it. And then I take my arm to 45 degrees. I want to find subscapularis. And I stretch here, 3 to 5. And then I do the other side. I try to do this as quick as possible. It's more important to do it often than just doing 1 hour stretches. This is done within 2 minutes. I would also do the elephant, where I hold my arm like this and try to find the infraspinatus. And then I can do my pec muscles. So stretching. And when I do my lat muscle, so what I do is that I take the stick, I put it on the inside of my leg. And from here, I just stretch. This is a great exercise. Save this video, take screenshots of the trigger points, share it with a friend that's in need for treatment for their shoulders. I appreciate if you subscribe and like. Thank you for your support.